passage of President Trump's One Big Beautiful Bill marked a seismic moment in American legislative policy, sweeping in its ambition and far-reaching in its implications. Yet while supporters have praised it as a bold push for economic growth and deregulation, critics across the political spectrum have raised serious concerns about its impact on vulnerable communities, the environment, and the nation's long-term fiscal health. Examining the bill's content reveals a number of contentious provisions that may have long-lasting consequences. One of the most alarming criticisms lies in the bill's reduction of funding to vital social safety net programs. Medicaid and the Supplemental Nutrition Assistance Program, SNAP, both face significant cuts, as the bill introduces stricter work requirements and reduces federal spending. According to the Congressional Budget Office, these changes could result in over 10 million Americans losing their health care coverage. Detractors argue that such measures disproportionately harm the most vulnerable, low-income families, the elderly, and individuals with disabilities who rely on these programs for basic services. Equally concerning is the bill's treatment of environmental policy. It eliminates tax credits and incentives for renewable energy investments, including those for electric vehicles and home energy upgrades. Environmental advocates warn that this rollback undercuts the United States' transition toward clean energy and may reverse progress made under prior administrations. Given the growing urgency of climate change, such a pivot has sparked intense backlash among climate scientists and activists. Education and healthcare aren't spared either. The bill limits access to federal student loans, particularly graduate programs, by capping loans and eliminating Grad Plus options. Critics fear this could diminish educational equity and widen the opportunity gap. Simultaneously, cuts to Medicaid threaten the financial stability of rural hospitals, possibly leading to closures and increased pressure on emergency departments. The bill's tax provisions have also become a flashpoint. While it makes permanent several tax cuts from 2017 that benefit corporations and the wealthy, it offers limited relief for working-class Americans. Estimates suggest that the top 1% could see annual tax savings of $26,000, while low-income Americans might lose more than $1,600 in federal support. Economists warn this could further exacerbate income inequality. Moreover, with the Congressional Budget Office projecting an additional $3 trillion added to the national debt over the next decade, fiscal conservatives question the long-term sustainability of these policies. Beyond policy, the political consequences are reverberating. Public opinion surveys reveal that a majority of Americans disapprove of the bill, especially in regard to its healthcare implications and perceived favoritism toward the affluent. Governors and mayors from across the country have expressed concern that the bill will shift financial burdens to state and local governments, forcing them to cut services or raise taxes to compensate. In sum, while One Big Beautiful Bill may fulfill some ideological ambitions of limited government and free market priorities, its critics argue that it does so at the expense of equity, environmental responsibility, and fiscal prudence. As its provisions begin to take effect, Americans will likely continue to debate whether the costs of this sweeping legislation truly serve the nation's best interests.